You are listening to the So Now What podcast with Lana Manikowski, episode number 187. So now what? These three words raced through my mind time and time again during my journey through fertility treatments. I tried desperately to have a child, but never was able. I yearned for a community to join that could understand my struggles. I couldn't find one, so I created one with the So Now What podcast. I love that you found us. I am so glad that you're here today because I want to talk today to the person that walked out of the fertility clinic with more questions than you had answers, or maybe wondering if your doctor understood how painful it was when IVF failed. If that is something that you want to talk about, this episode is for you because for a long time I have wanted to have this conversation, one that talks about the patient, but also the physician's perspectives. And when fertility treatments ends without a baby, both sides, I'm learning, are often asking the same question. So now what? As patients, we carry this heartbreak of what could have been. We leave with major considerations to think about: more rounds of treatment, adoption, donor, surrogacy, how we're going to move forward if it is childless. And oftentimes, from the women that I've talked to, it feels like there is very little support when the path ahead is one without children. And also for the doctors, I am learning that there is a big silence and heaviness that they feel too, because they've poured their knowledge, their energy, and their hearts into helping us as their patients and helping us wanting to build our families. And when treatment fails, I'm learning that sometimes they also are questioning what they could have done differently and if they have failed us as doctors. So that shared question, that so now what question, is the bridge that this episode was designed to build. And before we dive deeper, I just want to be clear that the intent of this episode is not to criticize or gaslight fertility clinics or fertility doctors or anyone who played a role in your treatment pathway. My desired purpose of this conversation is to bring awareness and understanding to what many women experience after the treatment ends. So you're going to hear reflections that I have gathered from women here in my community and women who are really yearning and learning how to create a life they love without the children that they dreamed of. And I am going to be including their words in this conversation just to share and educate and inspire change, never to cast judgment. So that is why I am so honored to welcome Dr. Erica Bove. She is a double board certified OBGYN. She is a reproductive endocrinology and infertility doctor at the University of Vermont Medical Center, where she's also the REI Fellowship Program Director. She, on top of that, is also a life coach and founded a community called Love and Science, and it's all about thriving through infertility. And her platform combines evidence-based medicine with coaching and community to support patients going through fertility treatments and physicians who are also navigating their own personal fertility challenges. So what makes her perspective so meaningful in this conversation today is that she's also been a patient. She works on both sides of treatment pathway, having navigated it herself, helping doctors who are navigating it, helping patients who are navigating it. So I felt like she was the perfect person to have this conversation with. So with that big intro, Erica, Dr. Bove, I'm very grateful to have you here. When we became connected recently through a OBGYN colleague of yours, she met me when she was here for a conference in Chicago, and right away she said that the two of us had to meet. So we hopped on a call and I felt like we vibed right away. So tell me, with all that I just prepared our audience with, what brought you to doing this work that you're doing in support of patients navigating infertility and doctors navigating infertility, and why this conversation today feels important to you?
Absolutely. Well, I just want to thank you for having me here on the podcast. I know what a tender topic this is, and near and dear to my heart. And I've been following you for so long. And when our mutual person said, basically sent a group text, I was just so, so elated. So, to answer your question, so I really became drawn to the emotional component of fertility treatments always, but especially when I was a new attending and I had all these ambitions about, see the patients, diagnose the problem, cure the patient, right? And we're taught in medical school that there's always a cure. And I realized that it's not that straightforward, right? Fertility journeys are often very long. There's often many forks in the road, which become decision points. And really, the reason I brought in coaching was because I felt a personal failure when I was trying to guide my patients through this experience. I brought in data. I would say, okay, these are all your test results. This is the working diagnosis. These are even reasons why, I think it makes sense for you to keep going. These are your choices. And I remember seeing so many people in my clinic who were truly paralyzed in the context of that conversation. And I started to think to myself, I understand that this is overwhelming. And I also understand that I am not reaching them in this moment, and they cannot even begin to make an empowered choice if they're in this state of hypervigilance, analysis paralysis, and fear. And so during that time, I was starting to access coaching for my own personal reasons, relationship coaching notably. And I started to really appreciate the coaching tools, so much so that I decided to go to coaching school during COVID. And as I started to say, how can I do better in my own clinic? How can I help people come back into their bodies? How can I help them make empowered choices? It was not about me fixing the situation. It was me helping people connect with their values and making empowered choices so that they could have their own experience of making an empowered choice and figuring out how best to proceed. So that's really the background of why I, sort of wear both hats as coach and doctor, because I think that combination is the most powerful way to support somebody going through infertility. I also am so grateful that we're having this conversation today, because I think, we as doctors don't have a lot of space to talk about when things aren't working, and how personally hard that is for us, and the grief that we feel for our patients. And I also think that sometimes that's not communicated, and I want to do better. And so that's really why I'm here today, is to bring my perspective and hopefully, have some ideas about how we might do better.
Thank you so much. I had the benefit of working 20 years in the medical field, and I know how hard doctors work. I know how many different directions you are pulled in. And I think sometimes from the patient perspective, we just expect that our doctors know everything. And sometimes the conversations like we're going to cover off on today, that's not taught to you in medical school or in training. So I'd love to know, were you given any type of training for how to deliver news when a cycle ends without a baby and a patient is moving forward without children?
Oh, that's such a great question. So I will say, I'll just sort of back up and go back to medical school. So I went to a very touchy-feely, let's just say, medical school at the University of Vermont, where I'm a Vermonter. So I love all the professors. We really did spend a fair amount of time on how to deliver, like, what would be considered bad news, but in the general sense, like not in the sense of, this is infertility bad news, but kind of in the general sense. Check in with the patient, see what they already know, see how they're feeling, ask permission to share, like all those different elements that I think are just not, many people are just never taught that. Like I have the benefit of having been taught that in medical school. I will also say, I know you worked in urology. My father's a urologist. And growing up, I mean, we were from a small town, and he was the only urologist in the community growing up. And he would invite me, with the patient's permission, of course, to sit with him in his office and to shadow him. And I think that watching him give so much bad news over the years with such care and compassion, I really think that I internalized that, because because it's not really sort of taught in the fertility specific way. I think I sort of borrowed the tools that I had gotten both from hearing my father give, especially prostate cancer, right? A lot of bad news about cancer, but then also the more general tools. But I will say, like, for people who don't really know, medicine is actually more like an apprenticeship, right? So you learn what you're supposed to learn in medical school, and then you go to your different specialties. So for me, it was obstetrics and gynecology. And yes, there's a curriculum, but it largely depends on like the exact patients that you see on a particular day or on that rotation who's there. And so you're learning from your attending physicians and how they speak to patients. Nobody ever really says like, this is how you have this type of situation. I think as an educator now, I'm like, we're going to talk about XYZ, take notes. This is the hidden curriculum because I'm aware that we don't formalize this enough. Again, I say you're going to borrow things from me, you're going to borrow things from other people, but be very intentional about what you see that you feel works and resonates with your style. And also what you see, admittedly, where you're like, I would never want to come off that way, or I would never want to speak in that way or with those words. I think we can learn from what we see that we like and what we don't like. So, it was that apprenticeship where I could sort of borrow certain things, but it's been sort of me picking and choosing and developing my own style, really. I don't think there was ever really like a formal curriculum.
Thank you. And how fortunate are we that we have someone like you to talk to today who can not only, bring your open and honest perspective, but also your desire to learn. And additionally, hopefully impart more from this conversation today in the future doctors and reproductive endocrinologists that are training with you and through your program. In preparation for this, you and I had talked at length about the vision that we had for the effectiveness of this conversation today. And I told you that I was going to talk to some women in my community and get feedback from them, because I certainly, through my 7-year journey of IVF, experienced my own struggles and my own desire for further conversation, which didn't happen. And I didn't want to assume that just because that was my reality, that it was everyone else's. And I had asked listeners of the podcast and folks that I'm connected to through my Thrive After Infertility community to answer some questions for me to help us prepare for some valid conversation points. So I'm going to share with you some things that people had shared that they had wished their doctors had known about what they were struggling with when their journey ended without a baby, or maybe some things that they had desired, maybe moved differently in the aftermath of receiving that news. So I'm just going to read off a couple bullet points to give you some context of where I'm coming from and where the listeners have provided some feedback on this. So one person told me that it would have meant so much if someone had called me a few days later or even a week later just to check in. Another person told me that after years of working so closely with my doctor and nurses, never hearing from them again was jarring. I wish they had offered an exit appointment, somewhere where I could ask maybe some last questions, get reassurance that it wasn't my fault, and feel like I had a real goodbye. And then 2 more things people shared, that even a simple email with some resources, maybe therapy or coaching referrals or articles on how to move forward without children, would have helped. And then one other person told me that she would have loved to have a guide on how to live without children, referrals to therapists, again, to coaches, maybe even introductions to others who've been through it. So when I asked people for feedback, you can see there's this overarching desire to have had maybe some more communication, maybe some more resources. Maybe after hearing this presented to you, what comes to mind for you? What are some things maybe you do in your practice, or are you interested in instituting in your practice?
Yeah, absolutely. And my heart goes out to those women who shared. And I know can be a very common experience. And so I'm so glad we're talking about it today. I think that every program, every fertility program has their own structure, and, there's some commonalities and there's some differences. I think that it should be like non-negotiable that every single person has a cycle review after every single IVF cycle. Whether they decide to pursue more treatment or not, I think it's very useful to meet with the patient and say, okay, this was your cycle, these were your meds, this is what went well, this is what didn't go as well as we had hoped. And, these are the ways moving forward. I think that's very valuable for every person. And, I know not every clinic is set up that way. I will say ours is, fortunately, but I personally can't see practicing in a way that there's not that closure for any cycle, right? Regardless of where people are at in the journey. before moving forward. And so I think that that's maybe one area that we could look at is, for clinics that are not currently offering cycle reviews, especially when people are deciding not to move forward with more treatment. But even before that, right? I think that should be standard of care, that every person has an opportunity to talk with their doctor to get their perspective on the cycle. I think that in terms of checking in, I think that when either the nurse or the doctor makes the phone call about a negative pregnancy test, that day is a day of a lot of emotions. And I think, when I get really bad news, I know that sometimes I just go into like tunnel vision, the equivalent of tunnel vision, where people are saying things to me, but I know I'm not in a state that I can receive anything, right? And so I think that point about checking in with a call a few days or a week later, I think that could really go a long way to show, like, maybe at that point the nervous system is in like a slightly better place to receive empathy, to receive some information about possible next steps, even before a formal appointment. So I think that that's a really great point. From the standpoint of resources, I will say I think this is a great idea. I was asked to speak on Vermont Public Radio recently about childlessness in Vermont. And when I really did a deep dive into resources of where people can go, I actually did not find very many resources at all. I guess I had not really sort of considered the paucity of resources until I really looked for them, because sometimes people have their individual therapist or maybe they have a coach. But when I looked at kind of like on a systems level, if we were to make sort of a list, a packet for people, like what could we offer them? There's one group after loss, grief after loss. But beyond that, it was very, very scarce. And so I do think that, we know that this situation happens where, people have unsuccessful fertility treatments. And sometimes there is a point where that closure conversation happens. I really think, even if it's not as many resources as we would hope, we should put together whatever we have, both locally and then also, including your information, Lana, to show people that there is a bridge to a child-free life. And it's I always talk to people and I say, now there's no more gray. Right now you have this chapter, the door is closing, you're entering a new chapter. And so that clarity, there's a lot of freedom that comes in that clarity, right? Instead of just waiting for the next treatment cycle or the pregnancy test or whatever it is. But I think we really do need to bridge people better to that new experience of life, with all the new expectations that come with that and the grief that needs to be processed. And so I really do think that saying for these situations, we need a resource list and we need to send it to each person, I think that should be mandatory.
Thank you for addressing that. And I think there is so much to think about. Like I remember my last conversation with my doctor. I live in Chicago and I was going to a clinic remotely outside of my state. So I would stim locally. And then once I got to a point, I would fly out to go finish my cycle and hopefully have a retrieval there. So, and this was pre-COVID, where it was, not as common to have Zoom calls and remote conference calls and things like that. So for me, my last conversation, my REI offered donor egg services, surrogacy, and adoption, and said, this is a lot to think about. Think about it. Let us know. And, I appreciated the fact that they realized, I wasn't ready to make that decision right then. But taking myself into where I was then, if I had maybe heard in that continuum of care type conversation, if you choose to remain childless, we can support you there too, or we still want to hear from you. I feel like I would have known that there was a reason to call back. But when I looked into adoption and donor egg and decided those weren't the right options for us after several months of thinking about it, I just felt like there was no reason for me to call back because it wasn't mentioned. So I preface my question with that to ask you, do you feel like it's an appropriate conversation to have that remaining childless is part of a next step for a patient in that conversation, or do you feel like it should be segmented?
I mean, I always offer it as an option. Just like when I talk to people who have just say somebody sees me and they have a new diagnosis of infertility and they've done no treatment. I always say no treatment is an option. Like, you don't have to engage in this way, right? That is part of the full spectrum of patient autonomy. I think you bring up a good point, and that sometimes it's gray. It's like, okay, these are the options, and then let us know, right, which you choose. But I think, whenever there's a hanging question, especially at this point in the journey, I really think it makes sense to set up another appointment, to say, even if it's like a 10-minute appointment, it doesn't have to be super long, but like, hey, have you thought about the options, including child free, right? Have you thought about these options, and what have you decided, and how can we best support you? I will also say, I mean, we talked about this a little bit in preparation for this conversation. My patients who have not been successful with treatment are always on my mind, and I think keeping in touch with our patients, that's my favorite part of my job, is keeping in touch with my patients, whether they have successful treatments or not, because you've built this bond with somebody, right? And so I've had people keep in touch with me over the years, whether or not they, were successful in their journeys. And that's very meaningful to me as well, too. And so I think we need a broader, you know, I, I think it's complicated, and I have ideas why. We can get into that, in a few minutes, but I think that we need a broader sort of idea, more expansive view of what it is to have a doctor-patient relationship, and what it really means to bridge people through this part of life.
Yeah, because it's a lot. It's a lot to digest. And I'm going to ask you to get into this a little bit later to know what it feels like to deliver that message as a human, not as a doctor,
Yeah,
but as a compassionate person who's been through fertility treatments, who
yeah.
I'm not sure how many rounds you went through until you
Mhm.
had a living birth. And we'll get into that. But before I do, I wanted to, while I was giving feedback of things that I received from the community, I asked also, what would you say to your doctor? Like, imagine you ran into them and you had an opportunity to talk to them, and what would you say? And I love that someone said, I would tell them, thank you for trying to help me. I just needed
Mm.
reassurance that we truly did everything we could and that it's not my fault. And I loved that there is still this love that we have in our hearts, even though there are not the rainbow baby stories and the miracle stories that we have to tell, but just that we still want to say thank you to our doctors. And then conversely,
Mm.
there's also someone that said, I wish they had offered me more than just advice about my sex life or suggestions to call if I changed my mind about surrogacy or adoption. I wanted acknowledgement that what I went through mattered. So there is this love that we have for our doctors because we feel so bonded and close to you and trusting you to really have guided us through all that we did. And we know how much goes into that, not just the doctors, the nurses and the clinic staff and the people you see when you walk in, and those familiar faces, like all of it is important to us. So when you hear these experiences, what does it feel like for you to be in that white coat and to be the one having those conversations with
Mm.
patients? Like,
Lana, to even talk about this makes me tear up, so I might start to cry.
yeah,
Um,
thank you for being you, Erica.
yeah. I mean, I think the fact that I'm crying kind of says it all. But to collect myself a little bit, I dread these conversations. I really dread them because, as a doctor, you love your patients, right? And you want them to build their families. I went into this line of work because it was the most meaningful work I could find. I actually went to med school to be a psychiatrist because I thought I could help people with their kind of like mental disturbances, or, maybe cure the world of eating disorders, or whatever ambitions I had when I was 20 years old. But I found in women's health, particularly this area of women's health, that the work is so meaningful, and it's not just about the end result. It's about navigating these beautiful, strong women throughout this process. And, I always knew I loved fertility and all of the pertinent issues. And so from the very moment I meet a patient or a couple, I feel very bonded to them. I mean, maybe I go in more detail than other people, but I want to know, like, how long have you been together, if it's a couple, and how do you spend your free time, and, what's important to you? Because I say this is going to be a journey. There's going to be some ups and there's going to be some downs. There's going to be good news and bad news along the way. And like, we need to have a solid foundation to be able to navigate that. And so I think that, as we start to understand more about each person's situation and what fertility factors are present, I really do love my patients. And so when we go through even the most quote unquote extreme of treatments, which is, usually IVF, and it doesn't work and it's not working, I think it can feel very much like a personal failure. Like, I want nothing more than to help you. And patients say all the time, I failed IVF. And I say to them, you did not fail IVF. You did nothing wrong. If anything, the science failed you. But I think at some level, those of us, and I mean, I think it's helpful to talk about it, with other people who do this work as well, to just say, I do not understand why this person's embryo didn't take. It was a beautiful embryo and the uterus was beautiful. And like, I put the embryo in the right spot. Like, what happened? Or say it's somebody where it's not working cycle after cycle. Like, I do not understand with the best of my knowledge why this isn't happening. And it can feel very much like a personal failure. And I think when that happens, I mean, you're a coach, you understand this like pathway, then it's like that sort of rumination of like, okay, did I put the embryo in the right spot, right? I don't struggle with that as much at this point in my career because I'm mid-career, but like, especially in the beginning, I would have a lot of negative thoughts about like, well, if Dr. So-and-so, my mentor, put the embryo in, certainly it would have taken, so it's like my fault it didn't work. I think, at this point in my career, when I know I've put the embryo in the right spot, it's more about like, that frustration, like shaking my fist at the universe, like, this is the nicest person, these are the nicest people, like, why is this not happening for them? It just feels so incredibly unjust. But then for me not to have the language to say why, right, or what we can do differently to make it work, I really do think it can feel like a personal failure. And a lot of us aren't comfortable with that. A lot of us don't, it's not easy to have those conversations. And so I think the human instinct is to kind of shy away from those conversations because of all the shame and all the other associations. I'm not saying it's right, but I'm trying to understand why it's so common that people don't have these conversations more often. Even to make the phone call about a negative pregnancy test can be like, I have a physiological change in my body because I do not want to be having this conversation. I want nothing more than to be giving different news. But it's nowhere near as hard as on the patient side, I will say that. But I think, I can speak for myself as a physician who does this work and really cares about my patients and cares about the work. Either there's grief, there's a lot of grief that I have from my patients, and that can be really uncomfortable.
Yeah. Well, thank you for being so honest, because like I said earlier, like we just think like doctors are made of steel, like you go to medical school and I think sometimes we forget that there's a human compassionate side that wants to cry with you. And
Yeah.
there's just such a beauty in you sharing this vulnerable side of you. So thank you, because I think it's just a beautiful reminder that there are so many doctors that are in this line of medicine for the right reasons. And sometimes we hear the dark side of things or put somebody that we don't hear from again in this box of, oh, I only mattered when I was a billable patient. Or you'll hear people say, the minute I wasn't a success story, they wanted me out of their practice. And maybe there are some people that practice that way, but I just believe in my heart that that's not the standard of care that most REIs are practicing from and went into medicine for.
Thank you for saying, I really wholeheartedly agree with that. And just from my conversations with my colleagues, like we talk among ourselves, obviously, HIPAA compliant, but just, I think it's really important, as if you're a doctor listening to this, podcast, and you don't have anybody to talk to about these things, I think it's really important at least to have one colleague you can say, man, I had a day. And sometimes it clusters, right? Because we don't just have one patient a day. We have like many patients in a day. And sometimes it feels like the bad news clusters. And it can be really hard to keep going, right? Because you're like, I thought I went into this to help people and I'm not helping anybody. All my pregnancy tests today were negative. Like, what's going on? And, for many of us actually keep like a box of notes. Actually, it's pretty common. People say, what should I give my REI? I say a thoughtful note is the most, for me personally, the best gift I could ever receive, because it honors the connection, right? You said people want to be seen and heard. I think that as doctors, we feel seen and heard when people write a very thoughtful note, no matter the outcome, right? Some of my most beautiful notes have actually been patients for whom it hasn't worked. And we keep those, like we keep them. If it's electronic, I keep it in an electronic folder. I like my little box, my shoebox full of, because on the worst days, we pull it out and we say like, okay, well, I helped this person in whatever that way that was, and it becomes tangible. And that's part of what keeps us going. So if you feel like you've had a meaningful connection with your physician, speak it, write it. I think sometimes you don't have to, but if you feel called to do it, those are the connections that help me keep going in the context of my day and my work, which is often giving bad news.
Yeah. Oh, that's so nice. I never thought about that. I
Yeah.
actually, like I said, I went to my second set of IVF treatments. I went to a clinic outside of Chicago. And now that I'm a member of ASRM, I went to my first meeting last year as a member of the mental health providers group. And I actually ran into my doctor who I hadn't
Um,
heard from or talked to since that last conversation. And, I recently wrote a book in April. And in that first chapter, I talked about that conversation, which if you asked me today, I could recite it verbatim. It was a voicemail telling me my embryo had trisomy 16. It was my only frozen embryo. And I'll never forget, his last thing was, I know how badly you and Jack wanted this. And I felt like he knew how much it meant, but I actually purposely went to find him and just tell him what I was doing and what I had done with my life
mm,
since leaving, because although for him, I don't know if he remembered me, possibly he did. It had been, since 2018 and this was, 2024. I don't know if my name rang a bell, but for me, it was really important to say and take ownership of how I changed my life too. And I think we can't always point fingers and blame what people haven't done for us, but I really try to impart this in my community and with the work that I do is like, how do we take ownership for what we have done for ourselves? And I felt really proud telling him what I had gone through and, the fact that there was a lot of devastation that I experienced and a lot of disconnection from myself and my life and my body because I felt like my body failed me, but also that I started a podcast in 2021, that at this point my book was still, not yet published, but that my book was coming out. I sent him a copy of my book when it did come out, and I want to transition the conversation a little bit about what would be helpful for you as a doctor for patients to tell you or check in with you, like how can we take ownership as patients, or do you feel like there's more that we can do in order to play a role in this
mm.
path for us?
That is a really good question. That is a really, really good question. I mean, my first response is I think my patients and my clients are some of the people who take the most ownership of anybody I've ever met before. You know, I I think that I think we need to take ownership of our feelings. I think that is really important. I think sometimes it can be easier to stay busy or to, you know, do something that sort of numbs our feelings in these difficult situations. So I would encourage everybody who's listening to have some way of having what I call emotional sobriety, which is that we honor our feelings and we work through them. We don't give them more attention than they need to, but if we are having grief, and I think this is like a complicated grief, that we have the appropriate support to work through that. So I would say, that is maybe the one thing that I see people not as willing to do. Like people will be willing to do the research on the different options, but when it comes to that self-care, that like mental health side of things, I think people see it as like an extra, whereas I see it as a mandatory. Like I don't think it's negotiable whether it's a therapist or a coach or the combination of both. I truly think the combination is probably the most powerful, but really taking ownership of how you're going to navigate the emotional landscape of this new reality, of this transition, because you can't go it alone. I think you do what you do, Lana, because you did. And you need support, you need a community, you need resources. It's just too hard otherwise. So that's the one thing I will say. It's not information, it's transformation. It's looking at it and saying, wow, that was really traumatic. it's not going to define me, but it's a part of me now. And I'm going to figure out how I can grow and learn in a way that will help me evolve to the next version of myself.
Yeah. Because I think I was no different. I blamed a lot of how I felt on my clinic, and that I felt like I didn't matter, that I was just a number, that, da 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 da. And then at some point, it's like, even if I still sometimes think that in the back of my brain, also, what can I take ownership of as a person who wants more for her life and who doesn't want to be defined in her brain as a failed fertility patient, and that the cycle failed. And, I understand that failed terminology is just part of clinical description of something. You can have a cancer patient who failed chemo, but when we don't know those descriptions of a cycle, we take away from treatment that we are a failed person when we are sometimes referenced to or read a report or something in EMR that says I failed a cycle. But I think it's really important to learn how to pull away from that definer and not see yourself as somebody who is failed or doesn't have the ability to create a future that feels connective and fulfilling. So I brought that up just because I think some people just don't know where to go. And of course, I started this work, like you said, because I was that patient, and I want to create an opportunity for change. And so I see it like, well, maybe doctors don't have the resources that they need. And if I show up and I have these conversations and I speak in a loving way to the medical community, because like I said, I do believe that there are well-intentioned doctors out there that care about us, but maybe they just don't know where to send their patient. Maybe I could be that one person who opens up their brain to the option that there's, more that they can offer their patient.
I think that you need to shout it from the rooftops, and we'll keep looking for opportunities for visibility. I think that sometimes doctors have blind spots too. And I wanted to bring that up because, there was a story I shared with you before, Lana, about a patient of mine who had recurrent pregnancy loss. And, she brought to the attention of my staff that she did not feel that I had appropriately taken care of her because she had gotten pregnant outside of our treatments. And so I said, oh, great, she can follow up with her OBGYN. And, I was totally blind to the fact that she felt abandoned by me in that moment. And again, speaking of taking ownership, I felt horrible. I had no idea I'd made her feel that way. I called her up. I apologized. I said, absolutely, you can have an ultrasound with us. Like, I did not mean to abandon you at all. Like, you are my patient. We will take care of you until we know the outcome of this. But it was like a wake-up call, because I did not know I had inflicted that pain upon her. And, I think in medicine, we take an oath, we say first, do no harm. And I really do believe that most of us in medicine take that very seriously. And so maybe, the first step is bringing in awareness to say a very good number of fertility patients feel this way, without closure with their REIs, feeling dropped by the clinic, and I've heard this from many people as well. I don't think everybody feels that way, but I think it's very common to feel the way that you've sort of, from the direct comments that you've shared, I've heard that a lot. I think that maybe doctors and maybe nurses as well, they don't know that this is happening, right? I feel like if there was the knowledge that this was happening, that we would do better by putting systems in place and resources to be able to help people to feel cared for throughout the whole journey and not like abandoned at the very end, right? What do you think about that?
I think it's really important, because when we don't communicate and we don't understand where one another is coming from, that's where people walk away with misconceptions. And having the ability to have these open dialogues and open questions, I think really is only to help one another, to help you be a better doctor, that patient who shared that information, and then for you to be the doctor who would then call them and address that and say, I didn't know, I didn't realize. Like, yes, you are welcome. You are part of my practice, and still I want to be part of your care team. I think that's really important. And I also think, in hindsight, had I had more courage, would I have called back the clinic and said, hey, like, I need another follow-up conversation. I need to talk through this a little bit more. It's been 6 months, and we have now decided that adoption isn't the route that we're going to take. And I still feel like I'm flailing out here. And so I think, would I still be considered a patient that the doctor would take time to talk to? And I'd have to say, in my heart, I'd say yes. I'd seen my story as still being one that was part of a necessary conversation. I would have probably reached out for more resources, or I don't want to use the word demand, but requested more really, or asked if there was more. But I just figured, I just was supposed to go off into the sunset.
Mm. Yeah,
Yeah.
I think it's an excellent point. And obviously you're a different version of yourself than you were then. And I always say, like, let my suffering, let that help other people not suffer as much, or maybe shorten the intensity or the duration of it, right? Maybe we can help each other suffer less. I wanted to share too, as you were talking, I was thinking about how like almost abrupt this transition is. Is like, okay, I've been so hyper fixated on having children that when this sort of closure cycle happens and it's like, okay, we're not going to adopt, we're not going to do third party or whatever it is. Maybe people have done third party and it still hasn't worked, whatever it is. Like, I think that we don't do a very good job cultivating a sense of meaning in life outside of this one facet of life, right? So part of what I do when I work with patients and clients is throughout the whole journey, I want to know, other than this one room in the house, right, the fertility journey, like, what makes people tick? How do people spend their free time? Do they have pets? Maybe they have nieces and nephews who fill their bucket, or whatever else. What, maybe somebody has a very meaningful career that they pour their heart and soul into. I think we so often equate the only way to live a meaningful life is if this fertility journey works out. I hear that all the time. And that's just a setup for, I'll also use the word failure. That's a setup for just emotional depletion, shame, negativity. We need to look at the whole picture throughout the process and say, okay, maybe you're an athlete. Fantastic. Maybe you, like I said, maybe you have a really interesting job and you do great work in the world. Whatever it is, we need to be identifying meaning throughout, no matter what happens with the journey. So it's like, I was a whole person before this. I'm a whole person during. I will continue to be a whole person afterwards. And this does not define me. Whether this works or not, does not define whether I'm going to have a meaningful life. And so I see that as very powerful. And I think, perhaps many people listening to this have already crossed that bridge themselves. But I think in a more broad sense, we need to be starting this work much earlier.
Yeah, I tend to find women that want to work with me are very goal driven. They're used to being successful. They're used to having a plan and figuring it out. And then all of a sudden the motherhood pathway comes to an end, and then it's like they look in the mirror and they don't see that successful person anymore.
Mm-hmm.
And I think a lot of it is this societal expectation that motherhood is what completes you, what gives you purpose. And yes, I believed that for a long time. But I also have found that I went to different things to find my purpose. I became very ingrained. I was already ingrained in my work, but when I left my fertility journey without a baby, I became even more focused on my job because it was an opportunity for me to see that I could do something well and get good results. And when that created burnout in my life, there's just different things that I was always exploring. And I think that's really how it's done. Like, you have to allow yourself to say, okay, well, this filled a portion of my chapter and this is great. And this doesn't feel good to me anymore. It's feeling more depleting than it is fulfilling. And what might else be available to me? So I think a lot of that is allowing yourself to, yes, continue to expand in those conversations and those opportunities to immerse yourself in new settings and new opportunities to say, this doesn't have to be my bridge for the rest of my life, but maybe the next couple of years I'm going to get enjoyment out of doing this.
Exactly.
Yeah.
What sorts of things have you found, in your process of this new chapter of life? I guess not new necessarily, but like, sort of, what have you found? What are some examples of things that you've found sort of filled that bucket, even if it was short term?
there was a big transition in like physical wellness. When I left my fertility treatments without a baby, I had gained an extraordinary amount of weight and then just sort of gave up on my body. I was on what I call a supplement strike. I didn't want to put any supplement in my body. My IVF drawer stayed there for 2 years with me not being able to open it and even think about caring for my body. But then I realized like this was just a portion of my body. Like my reproductive organs do not define my whole body. And I don't want to give up on my body just because a portion of it didn't work. So it was really this focus in getting healthy again and working out, doing things that I probably wouldn't have tried at 50. Well, I'm 51 now, but I started at 50 going to solid core and doing workouts that most people would be like, oh my gosh, like I would never try that at that age. But, just allowing myself to explore, obviously writing, becoming an author. Like I never thought I would write a book, and allowing myself to say, well, gosh, maybe you don't need to have an MFA in order to write a book. Like maybe it doesn't have to be the best written book, but it's a message that someone wants to hear. So I think allowing myself to not say I don't have it all in order to do it, but just say, I wonder what might happen if I try it.
That's so powerful.
So and we're coming up to the end of the segment, but I wanted to ask if you could tell a little bit about, what it feels like to work with doctors that are going through fertility treatments, and if you feel like that imparts maybe a difference in the way that they are treating their patients, whether they're going through infertility or depending on what their specialty is, like how you feel your work is helping to change the way that doctors practice in their personal practices.
Yeah. Yeah, absolutely. I'm open to working with all people. For some reason, the doctors are the ones who tend to find me the most. And I think, that navigating that bridge between being the person giving the information and giving the care to crossing that almost like a fence, right? To being the person receiving the information and in that more vulnerable state. I think that is one that's very difficult for most of us, as physicians. And so I kind of help people how to be better patients in terms of, first step is, right, you got to find the right doctor for you. And you have to be able to establish this trust, because otherwise there's this hypervigilance that takes over that is like really counterproductive. And so that's one of the things I love helping people with, is like how to be a patient, how to balance trust and advocacy, which I think is helpful for everybody, but I think is maybe especially hard when you're the one who's used to giving the care. And I also think, like any medical experience I've ever had, whether I was a family member of a loved one getting medical care or, my own journey, right? Like being a patient, in some way it makes us better doctors. I mean, I can't speak for everybody, but I think that like when I was a new attending, one of my fellows wrote about a miscarriage she had and how that changed her whole perspective on the work that she was doing, working with women, trying to build their families. And there's like this like humanity, right? That if we let it affect us and let it transform us, that we can then connect with the humanity and the suffering of other people. Even if we're like a rheumatologist or a cardiologist or something, we understand what it is to experience uncertainty. We understand what it is to suffer, to watch our loved ones suffer. And I think if we let us, it allows us to be more empathetic providers of the medical care. I think it's challenging because the fertility journey is at least a part-time job, if not a full-time job. And many doctors work, 60, 80, 100 hours routinely. And so one thing I help my people with, which I think also extends to other professions as well, is like, how do you say, okay, this is in a phase of life where I need to dedicate more time to this process, which means I might need to scale back another, pace of grace. I might need to scale back in other areas and use my voice to say, I need a reduced schedule right now so I can make these appointments and all of those things. So I think it is, it's especially hard when my physician patients and my physician clients are giving such extraordinary care, right, in their day to day. And then, when I can't help them, I want to be able to say, okay, well, the science is reciprocal, right? Like you do your thing with the science and you help all the people. And then I do my thing with the science and I help all the people. But unfortunately, it doesn't work that way all the time. And those patients who are cardiologists or rheumatologists or whatever, they have patients who aren't responding to those treatments, just like I have patients who aren't responding to the treatments. And so, as a doctor, what I say is I'm going to do my very best to leave no stone unturned. I'm going to think about you as an individual, right? We're going to, like, even last week, I had a very busy clinical week and I had a patient with an unsuccessful cycle. And, those are hard conversations to have, like we just talked about. And so I said, okay, we're going to talk about this cycle, but we're going to talk about the 10,000-foot view of your entire fertility journey. And guess what? We found another diagnosis that maybe because we had been so hyper fixated on one thing, that this other thing was in the blind spot. And so I think it's never too late to say, oh, maybe this additional view that we have now might lend new information. I think we have to be very humble and very curious all the time, not to just say, okay, well, let's just try this other protocol, or let's just do the same thing over and hope for a different outcome. But I think we have to commit as individual fertility physicians to say, like, we are going to do our very best by our patients in every situation. And it's okay to say, I don't know the answer. And sometimes we go to literature, sometimes we go to other colleagues, and sometimes there really is nothing we can do. But I think always to be compassionate, loving, empathetic, kind humans, no matter the situation. I think that's a non-negotiable. And if for some reason, you are on the journey still and you're not having that experience, it's okay to say, I need to find the right person for me. I need, and we all know that not everybody's the best fit, but I really think that having that connection with your REI, who's going to see you through all the way through, I think that's really, really important.
Yes. Well, Dr. Bove, thank you so much for sharing your insight and, oh my gosh, sharing your heart with us today. I really hope that listeners take away from today that improvement is possible, that the conversation is just starting and there's interest in creating improvement. And to the woman listening, if you ever felt like your clinic or your doctor forgot you after your final cycle, please know it's not because you did not matter. Maybe the system just has not learned how to hold onto endings or how to support at the time of treatment ending. But conversations like this are how that begins to change. So I appreciate your willingness to open up today. And to the doctors who may be listening, know that your compassion matters more than you realize. Maybe a short phone call, a few words, maybe even saying, I wish this outcome were different, can make a difference. But Dr. Bove, your work reminds us that medicine and meaning definitely do belong together and that healing belongs on both sides. So I'm going to include some information about Love and Science in the show notes. Is there anything else before we sign off that you'd like to share with listeners?
I would just say, you deserve all the support in the world. And so get the support that you need to bridge you through. We all need it ongoing, even if it's been many years. And so get the support you need, fill your well, build community. And Lana and I are going to do our best to really increase the awareness and build some systems so that we can do better. Thank you for listening. It's been such an honor to be here, Lana. Can't wait to collaborate with you moving forward.
Oh, well, thank you for being vulnerable enough to have this conversation. And like I said at the beginning, it was a conversation I've been wanting to have for a while, and I just hadn't met the right partner in the conversation. So I'm glad it is you. Thank you for listening. I hope you have a beautiful week. I love you. And remember that it's never too late to discover your meaning. I'll talk to you next week.
Hey, real quick, I just want to tell you about an awesome resource I created. If you have ever found yourself in conversations with people, or maybe people offering you suggestions about what you should do to become a mom, it's called The Top 27 Things People Say When You're Childless and How to Respond. You can get your copy free at lanamanikowski.com/thingspeoplesay.